Welcome to Community Health Matters. I'm your host, Kristen Presall. On average, a stutter lasts about 1 second, but more than 3 million Americans suffer from stuttering. Bonnie Wagner, a speech pathologist from Saint Thomas Midtown, joins us to discuss causes and treatments for stuttering. Roughly 78% of Americans have had at least one cavity by the age of 17. Stan and Carol Montee, the husband and wife dental team of Montee Montee Dental, join us today to talk about dental hygiene and best practices for at-home dental care. The shingles virus is painful and can be extremely uncomfortable for adults. Dr. Gregory from Siloam Family Health Center joins us to discuss the causes, treatment, and prevention of shingles. All of that coming up next on Community Health Matters. Did you know our teeth are meant to last a lifetime? And our tooth enamel is the hardest part of our body, even harder than our bones. To keep our teeth for a lifetime, we need to take care of them by brushing, flossing, and seeing the dentist regularly. To learn more about our oral health, just visit cdc.gov/oral health. Did you know approximately 5% of all children go through a period of stuttering that lasts 6 months or more? Most of those will recover by late childhood, leaving about 1% with a long-term problem. Stuttering is more common in boys than girls and tends to persist in adulthood more often in men than women. To learn more about stuttering, visit stutteringhelp.org. Welcome, everyone. We are talking with Miss Bonnie Wagner, who is a speech-language pathologist with Saint Thomas Midtown. And today we're going to be talking about stuttering. So if someone in your family, whether they be a child or an adult, is coping with stuttering and having that challenge in their speech, this is part of the program you definitely want to tune into and get some great information. Bonnie, if you can kind of define for everyone what stuttering is for folks who don't know.
Sure. So our governing body, which is the American Speech, Language, and Hearing Association, defines stuttering as a disruption in the fluency or the flow of speech. Okay. So the speech pattern would be disrupted by some type of change or a characteristic that stops or creates repetition in the speech.
Okay, there's 3 variations, I understand, too, of stuttering. If you can kind of talk about those 3, and then we'll get into causes, too, if you don't
Certainly. Mind. The 3 variations or characteristics of stuttering would be repetition, which I mentioned, and that is the sound repetition where it seems like someone gets caught in a loop.
On a word, yes.
On a word, okay. Or even a sound, usually the initial sound of a word, but not always. There is also prolongations. So a sound such as an L or an S or even a P might be held out for a long period of time and without release from that sound. Okay. And then the third one is a block where there is no sound. And so the person who stutters might begin to speak or be speaking and all of a sudden can make no sound at all, and that is a block.
And so you obviously, though, can tell that they're kind of stuck on that right now.
There's a difference between.
Okay. What causes, and maybe it's the same cause for all of them, but is there a different cause to where stuttering is brought on by folks? Well,
there's no one cause of stuttering. There are many, many theories about what causes stuttering, and therefore we look at the variations. For children, we're going to look at 3 different influences: genetic or hereditary influences, developmental influences when they're learning the language, and then environmental influences can create the stuttering. For adults who have stuttering, typically, if it's not developmental stuttering that has lasted for a long time, it's going to be created by a disease or a traumatic event, a brain injury or a stroke, or some type of condition such as a tumor or epilepsy.
Sure. You work primarily, I know, with adults.
I do.
And a lot of the folks that you just actually described in terms of, you know, those who actually have stuttering issues. Can stuttering be treated, or are you just kind of helping them along and just to kind of find those words and how to maybe take their time to, you know, be able to speak more clearly for themselves? I mean,
so there are a couple of different types of treatment.
okay.
The first type of treatment is a stuttering modification where you make the person comfortable with their speech pattern so that they can communicate within their environment with confidence.
That's great.
The second most common is a fluency shaping model. And so you are treating the speech pattern and trying to reduce the impact of the stutter and eliminate it in some cases.
So the people that you speak with, and like I said, the ones that you help and treat, they've obviously gone through, like you said, the traumatic type of event or something like that. Can they ever regain full speech again, though? I don't want to say curing stuttering, but can they get to the point to where all of a sudden they're able to speak as they once did before?
If it's developmental speech, the speech pattern is changed in a way that they didn't speak before, because as they're learning the speech or as they begin to speak from a young age, if it's hereditary,
sure,
you are giving them a different way of speaking. For neurogenic speaking, or coming from a tumor or a traumatic brain injury, you're changing the way that the person speaks, you're changing the way that they interact with their speech, you're modifying some of the factors that affect the speech. And typically people are able to communicate in their own environment at the end of therapy. Most of them are not going on to be public speakers.
Yes,
but some people are, and there are many, many famous people who have been able to overcome their stuttering in certain situations, and who are able to act or give public addresses.
That's great.
Yeah.
But, you know, and obviously progress is made.
Yes.
How that's defined depends on the patient, obviously,
It really
and what
does.
they've experienced.
Their personal goals,
sure,
and the learned behaviors that they have picked up along the way.
Yeah, that's good to know. All right, Bonnie, tell folks kind of how big of a population stutters. I mean, whether we're talking Tennessee statistics, if you have any, or on a national level.
We don't, that I could find, have any Tennessee statistics.
All right.
But nationally, we find that the incidence of stutterers is about 5%. That means that people who have stuttered at some point is about 5%. So the prevalence of stuttering for kindergartners is 2.4% nationally, and school-age children is about 1%. As you get into adults who stutter from a developmental standpoint or a hereditary standpoint, the prevalence is 1% or a little less than 1%.
And does it vary in terms of boy, girl, men, women, in terms of who stutters more, or if a certain gender does?
It certainly does. I believe that the male to female ratio in stuttering for school-age children or younger, kindergarten age, is 3 to 1. In school age, it is 1 to 1. And then as you get into the adult population, it's 4 to 1, male to female.
Okay. Also, for folks that you help, and I said in the very beginning, or even you did as well, talking about the adults that you work with, for those family members at home or friends of people who stutter, what's some advice you could give them, or some suggestions you can give them in terms of how to support their loved one and how to encourage them and help them when the speech therapist or speech pathologist is no longer in that setting? What can they do themselves to help?
For children, developmental stutterers, or even children who begin stuttering from a genetic or hereditary standpoint, you want to simplify the environment as much as possible. Children tend to get very overwhelmed, both emotionally and physically, and so keeping things quiet, having the TV off if you're having a conversation, those kind of things. And then the complexity of the message. So giving people who stutter the question or the statement that you want them to process in simple language.
Sure. Very good. And this is all great information, and hopefully folks will take the time and learn a little bit more, obviously, about stuttering, too.
We hope so.
Yeah. All right. Bonnie Wagner with Saint Thomas Midtown, we so appreciate your time. It was so nice to meet you, and you shared some really, really important information today. Thank you very much. Did you know the average person produces a quart of saliva daily? That's 10,000 gallons over a lifetime. Saliva is essential to good dental health because it washes food off the teeth, neutralizes acids in the mouth, fights germs, and prevents bad breath. To learn more about oral health, visit cdc.gov/oral health. Welcome back, everybody. If you are interested to know about good oral hygiene and maybe some helpful tips and suggestions on how to keep a clean mouth, this is the segment that you want to pay close attention to. We're visiting today with Dr. Stan and Dr. Carol Montee. They are with Montee Montee Dental in the Green Hills area of Nashville. We're so glad to have you all on.
Yeah,
Thanks for being here.
Yeah.
A lot of people want to know, when do you start taking good care of your teeth?
Really, you want to start from birth. Parents want to start, from the time their child's born. A good guideline is to bring your child to the dentist by the time they're about age 1, which is usually about 6 months after the first tooth erupts. It's important to do that early. Gets the child used to going to the dentist. It's good for the parents as far as education if they have any questions, and also helps to identify if there's any growth or development issues or baby bottle decay, things of that nature.
Okay, and you're basically, parents always do this, but they're cleaning their children's teeth for them, obviously. They obviously will give them the toothbrush after a while. At a certain age, they start cleaning themselves. But at what age do you finally say, okay, you're old enough, you need to be doing this on your own and doing it well?
I'd say about 3 years old.
Oh, okay.
Yeah, is when you should have your child to start brushing their teeth.
Okay.
You certainly want to do that before 3, but it's great for them to also watch you brush your teeth, watch you floss, so that they learn how to take care of their own mouth. And
flossing as well. I mean, I know 3 is kind of young, but is it when they lose their first tooth, or should you start flossing right away as well?
Ideally, it would be great to have a kid start flossing, but I've yet to see a kid that flosses,
or do it well.
Right.
So I guess when they get a little bit older is when to learn to do that.
Yes.
Because it's a little tricky even as an adult to try to get into your teeth and make sure that you're getting them clean.
Right.
How long should you spend brushing your teeth? And likewise for your children, and even as yourself. I mean, how long are you standing in front of the mirror and making sure that you're doing a good job?
Right. A good guideline is 2 minutes, and actually most people brush for under a minute. So we're in a little bit too much of a hurry.
Sure.
So 2 minutes is a good guideline, and for children, they have timers that can be a fun tool to use just to make sure your child's brushing long enough. And we do always recommend to parents to make sure to check their children's teeth after they brush. There are even some types of mouthwashes for children that will stain plaque, and so the child sees where they need to brush better.
Wow.
And those can be really helpful.
That's really interesting, especially for young kids who are trying to focus on what areas to reach and what to get.
Right.
Let's talk about specific foods that are no-nos for both kids and adults. Obviously, there's some kind of hard candies and things like that that you want to steer clear of, or gums, or I'm not really sure, but tell everybody what they should be eating and what they should avoid.
Well, you definitely want to eat healthy foods. You want to have a balanced diet. Potato chips are bad. Chocolate's actually good. It's not too bad for you. Yeah. It's because the chocolate will melt and it'll rinse off your teeth, whereas sticky foods like potato chips will stick to your teeth, and that causes decay.
Do you tell folks when they do eat those types of foods, brush right after? Is that even something that you think people might consider doing, or?
That would definitely help. Or if you're going to, like for instance, with like a sweet beverage, like a sweet tea or a soda, I'll always recommend, if you can't brush, to drink some water afterwards, or if you could chew a piece of sugarless gum, that would help to stimulate your saliva. It kind of naturally washes your teeth.
That's something that I'm glad you brought up, because the production of saliva is the most helpful thing, I understand, as far as keeping a clean mouth. Explain that, if you don't mind.
So saliva production, there are some things that can affect it negatively, especially for older adults that are on a lot of different medications that can cause dry mouth. There's thousands of medications out there that can do that, and so that makes you more susceptible to decay when you have a drier mouth.
Yeah. And we have different proteins in our saliva that protect us from the various types of bacteria. We also have minerals that help to remineralize the teeth when you do have what we call an acid challenge. So if you're going to drink an energy drink, for instance, it's very acidic, high in sugar. Within the first 5 minutes, the bacteria are going to love that sugar. They're going to eat that sugar, and they're going to produce a lot of acid. So in that instance, you want to wait about a half hour before you brush your teeth, because you could actually do more damage if you brushed right after drinking those types of drinks. And then your saliva will help, like I said, it has the minerals and has fluoride, and it'll help strengthen your teeth.
Okay, and I'm just going to refer to you as Dr. Carol and Dr. Stan,
That's
because
fine.
I don't want to say
That's
Dr. Montee.
That's what our patients call us.
So Dr. Carol, you had mentioned, drinking water and maybe having a piece of sugarless gum. When you are having certain types of foods that that might either stain or kind of cover the tooth, can you have that splash of water to help no matter what you've just taken in to kind of alleviate any problems that might come up?
Sure, that'd be very helpful. Yeah.
Okay, so that's just a little tip or a trick that someone could do right afterwards.
Yeah.
Let's talk about mouth pain, because I know there's all sorts of different reasons that someone might be able to have pain. Name a couple of those, whether it be cavity or gum related, or what usually gives us pain in our mouth.
The thing that we see most often in our practice when people come in, they have mouth pain, it's due to a dead tooth. You've heard of people needing a root canal. What happens is the nerve dies inside, and they'll come in with just an intense throbbing pain. They may be sensitive to something cold. When they drink a cold drink, that cold will last a long time. They may have an abscess in their mouth, so that's something we typically see.
Okay, and I guess for kids, it's probably another tooth pushing up, because I know my children have complained about that, and usually that's what it is, is when one tooth is still there, the baby tooth, but you've got another one coming up. So I guess it could be related to that as well.
Absolutely.
For younger ones.
Sure.
Also, let's talk about switching out toothbrushes, because that's something that people don't consider a whole lot, and just in terms of when do I get rid of the one that was issued to me by my dentist, how long can I use it, if I'm sick, do I throw it out, or what would you all say?
Well, usually a good guideline is every 3 to 4 months, but if you see that the bristles are starting to bend or kind of fray, then it's time to change your toothbrush. If the bristles are fraying very early, then that could mean that you're brushing too hard, and that's something that we see pretty commonly.
Okay.
The other issue would be that if you are sick, that it is a good idea to change out your toothbrush, because the bacteria can live on your toothbrush and cause reinfection. So.
For folks who use, and I'm sorry, Dr. Stan, go ahead. I know
No, go ahead.
Did you want to add anything?
I think I'm going to answer your next question.
I was just going to say, a lot of folks have turned to, electric toothbrushes, because let's face it, I mean, when they were coming out with all sorts of neat gadgets, everyone wants one of those. What is better, a standard toothbrush, or are some of those electric ones pretty good?
If you look at the research, actually, the electric toothbrushes are by far better than the old manual toothbrushes that we grew up with.
Okay.
Both of the electric toothbrushes on the major brands that are on the market right now are effective. Personally, in our practice, we recommend the electric toothbrush with the round toothbrush head on it and not the square.
Okay.
If you go into your dental office and you have your cleaning and you look at what the hygienist is using, she's using a round little brush to clean your teeth. And the reason for that is it really cleans all surfaces of the teeth. It does a nice job of getting in between the teeth, and you can actually get it behind your far back molars back there, where it's very difficult to do that with a square head. So,
and I was also going to mention electric toothbrushes are really good for children, or even like older adults who maybe their manual dexterity isn't very good.
Oh, that's
so they're really good options.
Okay. Also talk about gum disease, if you don't mind. That'll be the last thing that we cover. Explain that, please.
Well, gum disease is basically an inflammation in the gums, and it basically deteriorates the supporting bone around our teeth. So it can be very serious, and in the most severe cases, it causes tooth loss. So there's some important factors as far as keeping your teeth not just brushed, but flossed. If you're not flossing, that's when you're going to be prone to gum disease. And there's also some risk factors like smoking or diabetes that also can lead to gum disease. So it's important to keep those risk factors under control. And I'm trying to think if there's anything you have to add to that.
No, that's about it. That's great.
Well, you both have terrific smiles.
Thank you.
I think you always want to go to a dentist who has that,
That's
obviously. And twice a year is what we should probably go and see your dentist and check in to make sure. Okay.
Yeah, that's
well,
right.
Dr. Carol, Dr. Stan Montee, pleasure to meet you. Thank you all
It was
for
a pleasure,
sharing such great
Thank you for
information
having
with
us.
everyone today.
Thank you. We appreciate it.
Did you know a person with shingles can pass the virus to anyone who isn't immune to chickenpox? Anyone who has shingles and is contagious should also avoid contact with people with a weak immune system, newborns, and pregnant women. For more information on shingles, visit mayoclinic.org and search shingles. You may have seen TV ads or even some sort of advertisement at your local drugstore for a vaccine for shingles. But what exactly is shingles and who gets shingles? We're going to find that out in this segment right now. We're talking with Dr. Gregory. She's an internist and pediatrician with the Siloam Family Health Center. We're so glad to have you on here today. Thanks for being with us. I guess maybe define what shingles is for folks out there who don't know. A lot of people, though, you're hearing, like I said, a lot more about it and obviously seeing the vaccination advertisements. But tell us a little bit about the actual, condition itself.
Sure. Well, shingles is a condition that's characterized usually by a rash. That's what people usually think about when they think about shingles. But it's a segmental rash, usually on one half of the body.
Okay.
Typically, it will begin with some pain or tingling in that area and then followed a few days later by a blister-like rash in a little cluster form. Sometimes those will then ulcerate and crust over.
Goodness. Does it spread or does it stay within one certain area of your body?
Well, because of the cause of shingles, it descends down a nerve, and so it will stay in that pattern of the nerve distribution.
Okay, let's talk about the cause of shingles. What exactly does cause shingles?
Well, many of you have heard of chickenpox. The same virus, varicella, that causes chickenpox causes shingles as well.
All right, so if you were somebody who had chickenpox when you were younger, you're more susceptible then to getting shingles as you age, correct?
Well, really, if you have not had chickenpox, you can't get shingles in older age or when your immune system is down. But people may have had chickenpox and not even realized it. Sometimes it's a really mild rash.
Sure.
So most people shouldn't assume that they're not susceptible to getting shingles.
The good thing is, though, there are immunizations for that. And for chickenpox, too. So we should probably mention that. Both of these came out at different times. Tell us, Dr. Gregory, when both vaccines came out and who could be a candidate to receive those vaccines.
Sure. Well, the varicella vaccine, which is the chickenpox vaccine, came out in 1995 in the U.S. It's given at ages 1 and 5 and is very highly successful at preventing chickenpox, about 90% successful at preventing chickenpox.
Okay, if you're older and you didn't have chickenpox, can you still get the vaccine? So I'm 30 years old and I've never had it, and I want to say I don't want shingles either. I'll get one or the other. So I imagine you get the chickenpox vaccine, correct?
Well, really, in that case, you should discuss with your doctor about getting titers drawn to see if you've had chickenpox or about getting the vaccination.
Okay.
And even in that case, go ahead and get the shingles vaccine after age 60 to prevent, in the case of the immune system being compromised or a period of high stress. Even old age can make the immune system wax and wane a little bit.
Sure.
And make more susceptible to shingles.
Okay, you had mentioned the vaccine when it came out for chickenpox in 1995. Talk a little bit, too, about the vaccine now for shingles, when it came to be, and who should be lining up and getting that shot.
Sure. The shingles vaccine came out in the U.S. around 2006, so more recently. And the CDC recommends anyone over 60 go ahead and get that vaccine. Even if they've already had the shingles before, it's recommended that they get it.
Okay, and why that age? I'm curious to know, obviously shingles comes about later on in life, but why is that? Is it because your body is changing so much and because of that shift and change, that's when things like this present themselves, or why is it?
Well, part of it's the time that has lapsed since the exposure to that virus.
I see.
But also with age, as a lot of things change, the immune system also can be a little bit weaker. People who are experiencing very high stress, illness, or using medications that may compromise their immune system would also need to be very cautious about shingles. So it wouldn't just be older adults who would need to worry about it, also people under those conditions.
Okay, is shingles contagious?
Well, that's a tough question to answer because it depends on who's being exposed. So the virus itself, varicella, is highly contagious, which is why when we were children, everyone in a classroom at some point got chickenpox if they were exposed. However, in the case of shingles, It's not possible to contract shingles from being exposed to someone with shingles. So let me explain a little bit.
Okay.
If someone who had never had chickenpox before were exposed to someone with shingles, they wouldn't get shingles, but they would likely get chickenpox from that case.
Goodness. Even depending on age or no? Like I said, I mean, if they were 60 and up, they wouldn't get shingles, they'd still get chickenpox, huh?
If they had never had the vaccine and never had chickenpox before, they would.
How interesting. And I will say this as far as my mom's concerned. I have two older sisters. She had us all kind of in the same room at the same time thinking, well, if one has it, they might as well all get it. But that's probably not ideal way of thinking. Or what would you recommend in terms of if you have several children and there is a case of chickenpox in your family, what do you do?
Well, thankfully, since we have the vaccination now, most children, even if they are exposed to chickenpox, will not contract it now.
Okay.
Caution should be taken in cases where there is an infant in the house because the vaccine cannot be given until the child is 1 year old. And then in the case where there would be a pregnant woman exposed, especially a case where she has never had chickenpox or the vaccination before, that would be dangerous because the virus can pass to the baby.
Transmit to the baby. That's good to know. If somebody thinks to themselves, I may have shingles or I'm getting some of the symptoms that you had talked about, at what point do they pick up the phone and call their doctor or an internist and say, may I come see you? This seems like it might be something more than just a little rash.
Well, I would say right away.
Okay.
Because if it's not shingles, needs to be figured out anyway.
Sure.
If it is shingles, there's treatment for it. So antiviral medicines are used to treat and shorten the course and lessen the symptoms. And the antiviral medicines can also decrease the likelihood of complications of shingles.
I was going to ask you, as far as treatment's concerned, is it topical? Is it a medication that you take by mouth?
It's a pill.
Okay, it is a pill. And how long are you taking this type of treatment if you are diagnosed with shingles?
Well, the doctor would need to determine what the best medicine is. There are several different choices for the antiviral medicine that would be taken. So depending on insurance and costs and other medicines you might be on, it could be different for other people.
Okay, and how long does shingles typically last in terms of it being in your body and you having to deal with this?
That's another one that really depends on the person. Some people are going to experience just a short period of that rash, the burning pain, and it's going to go away even within a couple weeks. And some people may experience that pain as postherpetic neuralgia, a fancy way of saying a prolonged pain syndrome after the shingles, which is one of the major complications of shingles and why it's really important to be vaccinated and treated. But
much like chickenpox, when you have shingles, don't go to work. I guess you need to steer clear of people, not going to church and things like that, just so that you don't expose others. Is that correct?
Well, really, if it's covered and it's not
and you're being treated, I suppose?
And being treated, and you're not going to a place where you're going to be exposing infants, pregnant women, people with compromised immune system, or working in a nursing home, something of that sort. If you can keep it covered where it's not exposing anyone to it, it's something to discuss with your doctor, but it's possible that you could still work.
Okay, and for folks out there who might want to know, if they had a bad case of chickenpox when they were younger, would they then have a bad case of shingles?
Not necessarily.
Okay, that's good to know. Any other tips that you can suggest, or a good piece of advice you can give folks out there who want to know more about shingles?
Well, just remember, if you do have the shingles, it's important to be evaluated quickly so treatment can occur. Occasionally, those blisters that crust over can become infected then with bacteria, so it's important to keep them clean and dry to make sure someone's seen it and is monitoring it, especially if it's an area on the back where you can't see yourself. And then be very cautious about exposing others.
Sure, all great information. All right, Dr. Kat Gregory, who is an internist again and pediatrician over at the Siloam Family Health Center. We appreciate your time. So good to visit with you. And thank you all for tuning in to Community Health Matters.